What would you do if you were an executive and someone came up to you and offered you more resources than you could ever imagine? A long-term time horizon that didn't put any pressure on having outcomes and meeting targets urgently. And what if you had 1 million employees, 1 million people with which to try this experiment? And what if someone said, we want you to do this, we want you to break the system? If those were the situations that you found yourself in, what would you do? Hi, I'm Bruce Spurlock, a physician and healthcare leader committed to helping professionals and decision makers navigate change with clarity. At Viral Healthcare, we explore the trends spreading across healthcare and how to implement them wisely and sustainably. So this is a reflection on part one of a 4-part series we have looking at Haven Healthcare. And we're on part one, going back to the beginning. It's easy to use hindsight bias to know what we know now and try to pick apart all of the decisions, all of the things that went wrong with Haven Healthcare. But what I really like to do, and what I think this whole week we tried to do in our podcast, was to really go back and put ourselves in the place that the leaders did at the time. And what would we do in those kind of environments? So it's 2018, and Amazon with Jeff Bezos, and Berkshire Hathaway with Warren Buffett, and JP Morgan Chase with Jamie Dimon all said, we're gonna combine our activities, combine our efforts, and we're gonna fix healthcare. Because after all, we know that healthcare has been broken for a long time. There have been a lot of attempts to improve it, and things on the margins have gotten better, but there are so many challenges with cost control 2 to 3 times higher than what inflation has, and transparency missing, and convenience and understanding for patients, this difficult system that they have to navigate. So everybody knew at the time in 2018 that we have a lot of problems in our system. And these were 3 private sector, very large companies that said we have with 1 million employees and this long-term time horizon to accomplish things. I mean, Warren Buffett said that healthcare, American healthcare, is a hungry tapeworm, just gnawing on the inside of our organization and our country. So interesting time. They hired Atul Gawande. That was one of the first decisions they made. And Atul's job was to do it exactly what they said. Let's try to fundamentally overhaul. So think about, I don't know if you know Dr. Gawande or not. He's a surgeon. He's written broadly about a lot of things to try to disrupt and look at healthcare from ways that you could fundamentally fix it. He's been all over the country and all over the world to understand how healthcare works and how it doesn't work, but he's not an insider. He's not an insurance executive. He doesn't run a healthcare company. He's kind of a thought leader from Harvard, and really someone who's explored what it would take to try to fix the healthcare system. So they chose an outsider to do this. So here you are, you have 1 million employees, and you have this long-term time horizon, and you have these resources that seem unlimited. Probably there are limits to it, but they certainly are a lot of resources to try to address. And you know all the problems with healthcare. If somebody came to you and said, would you take this job? Would you? I mean, it's easy in hindsight that we know that in 2021 they shut it down, but I'm talking about back in the time without that hindsight bias. Could you have imagined yourself in that kind of setting? All right, so let's say, it'd be like the dream job. If you had all of that resource and all of those things behind you and all of the opportunity and 1 million employees all across the country to be able to try to chip away or make major changes in the way healthcare is delivered so that the customer is benefited from it. That's the patient, the consumer. If employers and the people who pay for it benefit because we get costs under control and we don't have anything like what we see with cost inflation in healthcare. And what happens if the system is more effective so that we can navigate it and get things done and avoid hospitalizations that are unnecessary or trips to the emergency department, and chronic disease is well under control? Can you imagine how exciting it would have been if you were to do that? So here's the question. Yeah, I kind of get that probably most of you probably would. I certainly would have. I might have thought and had imposter syndrome and doubts about whether I could do it. I certainly do now. but I probably would have had doubts, but I would have taken it, I think, if I'd have been given the opportunity. The real question is like, then what? What do you work on first? Do you try tackling the whole system? Do you break it down in parts? Do you take a portion of the country? Do you take one of the businesses? Do you take one aspect of healthcare? Or do you like completely break it open and see if we can redesign it from scratch? That's the question I want to talk about in part 2, because this is a 4-part series. We just did part 1, and we're going to explore what are the next steps on implementation and how does this relate to other things we've talked about in viral healthcare. So if you're excited about this, join me next week when we talk about this both in the podcast and in the reflection. Now, if this is the kind of thing that you like, these activities, how we're studying healthcare and how it spreads in the real world, tell a friend about this, especially if they're innovating or implementing an innovation. I'm just so excited about this whole 4-part project, and I love to talk to you about it more. I'm Bruce Spurlock, and I'll see you the next time.